Extrinsic conditions around eating, such as calorie density and portion size, and setting and social environment, can influence appetite and the amount of food that's eaten. For example, eating at home and family dinners have been associated with healthier food intake and lower risk of being overweight, whereas watching television during meals is correlated with unhealthy eating and an increased risk of obesity. The way these conditions influence the appetite and weight loss varies greatly between individuals. Unfortunately, for those who are trying to lose weight, calorie restriction and weight loss enhance appetite signaling, increasing the desire to eat. Combined with weight loss associated changes in energy expenditure, the result is often the inability to lose more weight or weight regain. In those eating a high-calorie, high-fat, free saturated fatty acids can cross the blood-brain barrier and can trigger inflammation in parts of the brain that are, among other things, regulating appetite. These brain areas, like other parts of the body, then become resistant to the signals from the insulin and the leptin. On the other hand, short bouts of exercise can suppress appetite in the short term, and habitual exercise appears to improve the sensitivity to the appetite regulating system. Stress is one of the most important external factors affecting appetite and eating behaviors. Although the response to stress is highly individualized, in general, acute stress is associated with high levels of catecholamine neurotransmitters that reduce appetite, while chronic stress is usually associated with high levels of cortisol, a hormone that appears to promote a selective appetite for high-calorie, palatable foods. Often referred to as comfort foods, they are typically high in sugar and fat, and they can stimulate the reward pathways in the brain to reduce stress reactivity, and they might relieve negative emotions associated with stress. This can explain in part how stress can induce overeating of high-calorie foods, and highlights the importance of stress management as part of a healthy approach to weight loss. The most commonly used measure for identifying overweight and obesity is the body mass index. The BMI is calculated by dividing the body weight in kilograms by the height in meters squared. Because it doesn't distinguish between fat mass and lean mass, or it doesn't take into account body fat distribution, BMI is limited in its usefulness. Nevertheless, it's been shown to be reasonably closely correlated with more definitive measurements of visceral fat, such as computed tomography and magnetic resonance imaging, and with obesity-related complications. Although the cutoff rates can vary with ethnicity, according to the CDC, an American or European adult should have a BMI between 18.5 and 24.9 kg per meter squared. Less than 18.5 is considered underweight. Between 25 and 29.9 is overweight. 30 kg or higher is obese, and 40 kg per meter squared or greater is considered extremely or severely obese. Abdominal fat is a stronger predictor of metabolic disease than body weight. Therefore, assessment tools that take the abdominal size into account better reflect the health status with regard to overweight and obesity. Waist circumference and waist to height ratio, the waist circumference divided by the height, both correlate well with the percentage of body fat and the metabolic disease risk. With strong evidence for its usefulness and simplicity of measurement, waist circumference is now included among the diagnostics criteria for metabolic syndrome. In general, a waist circumference of greater than 40 inches for men and greater than 35 inches for women is considered indicative of a high metabolic risk. Waist to height ratio may be slightly more accurate than the waist circumference and the BMI, and it has the added advantage of a single reference for people of all ages. A ratio of greater than 0.5 is widely accepted as indicative of central obesity in children greater than 6 years of age. A study that included 1,856 men and women between 46 and 73 years of age used more than a dozen blood tests, as well as blood pressure and body measurements to assess metabolic health, comparing metabolic health status to BMI and waist to height ratio. The study showed that a combined assessment of the BMI and the waist to height ratio provided the most accurate reflection of metabolic health. Similarly, a study done in Singapore found participants with both a BMI of greater than 23 and a waist to height ratio of greater than 0.5 had the highest cardiovascular risk. In addition to measures of body size and composition, certain blood tests can help to identify underlying causes and evaluate metabolic health status in people who might be overweight or obese. For more on weight loss, continue on the series, or for information on herbs, supplements, and natural treatment plans, check out my website.